Okay, start. Thank you. So, good day, everyone. I would like to welcome everyone to this episode of the podcast. And today we have a very important guest with us, and actually, he will be taking us through a very important topic. This topic is something which have been bothering every one of us as medical students. The title of the topic is Becoming a Genuine Medical Student, Focus Productivity and Exam Success. Now, our guest today is in person of Dr. Suleiman, who is a pediatric hemato-oncologist. And I'll let him to introduce himself formally. You are welcome, sir.
Okay, thank you. Like you really said, I am Suleiman D. Aliou. I'm a pediatrician with bias in hemato-oncologist. Yeah.
Okay, thank you very much for the brief introduction. So, sir, the first thing we would like to get from you is we'd like you to just in brief tell us how was your journey and some of your experience through medical school, sir.
Okay. Thank you. All praises be to Allah. First and foremost, we should understand that we don't become anything in life except it is ordained by Allah. This we must understand clearly in our mind, meaning that whatever you become, especially as a doctor, it's not your making. It's what Allah has ordained for you. We only follow the pathway with determined struggle. Yes, of course. Why do I say this? When we started the journey as a medical student, that was as far back as 1991. Yes. A lot of us, we didn't even know what medicine is all about. Yeah. We just hear that, okay, we have passed. We're giving MBBS. Nobody, we didn't have anything like guidance as per what it entails. Yes, people look at you, you have MBBS, that's all. But all the intricacies is not even known to you as a student then. Alhamdulillah, we started, of course, with the bottleneck. You have to merit so many courses before you can even proceed to 200 level. Yes. Yeah, and why do I say it's Allah? There are people you know that they are brilliant than you, but they get withdrawn. They were advised to change course from 100 to 200 level, 200 to 300 level, yes. But you know that naturally this person is better than you. No, not about that. It's maybe just by chance and by way of destiny, what Allah gave you the strength to say, he was not able to say it at that time. And we all know that this knowledge is tested just within 15 minutes. 10 to 15 minutes, they have taken their decisions. And they see themselves withdrawn. It's not easy. And it's also not difficult. Rather, what it takes is just determinations in everybody. Of course, for experience-wise, medicine is interesting and it's horrible in the sense that when you commit yourself from day one as a medical student, it's like a war that you didn't know what it entails, but it's very fashionable. But now that you have entered, then you now see a lot of limiting forces that can lead you out of the profession. And you wouldn't want it, so that now make you to be on your toes at all time. Because right in your front, you see your roommate that is no more. He has been withdrawn. He has been advised to go to that time biochemistry, zoology, and something like that. Yeah, applied biologists. And they say, and already people have known you that you're a medical student, and you are even kaifusing with your word code. Yes. Sir. So you see, that is the challenge. It's a lot of. So no, you not even know when you not be able to even integrate yourself into the societal system in terms of social activity. You not even know when you withdraw because the time is not there for you. At the end of the day, people will look at you as if you have sidetracked yourselves all the time. Book. But if you don't, with that owner, you don't even know you are doing this because all your aim is that how do I cover this? How do I cover that? How do I cover that? So that before this exam, so that I will not be among those that will be withdrawn. And everybody know that one of the terrible exams we did in Sokoto then is first time BBS. First time BBS, you can be 18, 20 that write the exam, but less than 10 will pass. Then they will give you to have a receipt. From receipt, you didn't make it for you to have to repeat. After that, that is the end. Even if you pass the 2 and remain 1, and you must get minimum of 50. So honestly, it's not easy, but alhamdulillah, it has not been a smooth journey, but we thank Allah to have surmounted it. So it's really interesting, actually. Thank you.
Thank you very much for setting up the stage for us, sir. So, sir, there's like a common struggle which almost everyone in medical school is like either is going into it or is about to face it or is hearing people facing it. So I would like us to briefly talk about that and let people understand how to really navigate some of these things. We have some of the common struggles like stress, burnout, distractions, which is very important because the coming up of crypto and all those kind of things, and also self-doubt. Because many of us looking at pediatrics, I'm one of the person that I heard so many stories about pediatrics. I actually doubted myself looking at the volume of the textbook, the Azubike, and also some of the slides that are being given to us. So I would like you to really talk about these things, the self-doubt, distractions, burnout, and stress.
Okay. Before I even go into that, in fact, I really I really appreciate the current medical students. Why do I say so? When I was a student during my time, I think maybe we only had 1 or 2 people that get married. Then, unlike what I'm seeing in Kanu, almost everybody is married. If as a single person, then I know what it takes. You can imagine a married person, more especially women that are married. They need to satisfy their housework. They need to satisfy their husband. And they also need to satisfy what the medical school wanted from them. That is as a married person. That is for the woman. It's so hell for the woman, I must. Then for the men who are also married, he has to think of what the wife is going to eat. In addition to himself, they have children, what their welfare generally. Then you now come to those who are single. So you see, they are going to be from different perspectives. But in overall, first and foremost is to have a clear goal right from beginning. Set up your goal. Yet every day there are so many things that comes your way or something like that. But ask yourself the reality. Which one will I be able to do? Which one I cannot meet up with? For instance, you're a medical student. You know your lectures go from 8 o'clock up to probably 10, 11, and you have ward round to attend. And inside ward round, you would have expected to have clerked a patient to present to your consultants. Again, there's after that, in between, there is what we call tutorial. These tutorial are governed by the residents under the supervision of the consultant. After that, you have a call to take. And this call, you are expected to attend to see how it's been done, the housemen, how they attend to emergencies, and you have to emulate them. In addition to clerk your patient, and of course to prepare for one round the following day or clinic, as the case may be. So you cannot marry any other thing into this. So you have to say, okay, at so time, this is what I have to do. At so time, this is what but this one, there is a wedding here, I can't go because it has come in between. I have to do this because my wife or my husband will need me this, or my children. Okay? No, I have family to go and visit. Initially, I thought it's going to be this weekend. I cannot because there is a crew assignment that I have not done. So you must set out your goals right from day one. That this is what you think you'll be able to achieve on daily basis. On daily basis, you have to set up your record straight. Then, in addition, you must read. Because all this thing you are doing, you have to still set out your time to say, okay, let me go through this to assimilate what I have been taught or I have seen doing. Or no, I have bedside. And now you have to form your note. And again, to overcome all these things, that is why group discussion comes in medical school. Because apparently, the syllabus of any medical student is human being from head to toe. That's your syllabus. I remember when I was on 200 level, I was asking my physiology teacher then, when he taught, I didn't really get what he was saying. And I went, some of course, I said, sir, so yes, come, I went forward, sir, thank you. Please, you've been teaching me, I really don't get it. Well, what is my syllabus in physics, in physiology? What is the syllabus for me to cover in physiology? He said, okay. He called another classmate of mine then. He said, I should look at him from head to toe. That is my syllabus. And that's how it is, and it ends there. So, this is just physiology. Anatomy is a different ballgame because you have gross anatomy where you are expected to cover all the system. Yes. Isn't it upper limb, lower limb, thorax, abdomen, head and neck, and neuro? And in addition, you are expected to also carry out dissection in all these various systems, and you'll be assessed. Meanwhile, that is just gross anatomy. What of the embryology? It's a part of anatomy, which you must read. And it's also system by system. What of histology? So this is where group discussion comes in. And now, most of them, we used to go to our permanent site to get biochemistry lecture. So, do you see? You are doing so many things at the same time. You have to reconcile and you must get through. And the only way you can do this is what we call like a division of labor, group discussions among your members. Okay, we're going to read gross anatomy today. Which topic? Divide topic yourself. You read everyone, but you specialize on your own. So that when you come, I remember there was a particular test we had to do on anatomy in gross. That time they'll say you have an anatomy test. Nobody will tell you which region. No. And there's particular topics on, I still remember, cause and relation of what is it now? I can't remember. I think it's about facial nerves. A colleague of mine, they will use the name, was given this topic, and about 6 of us. So we all read, but everybody specialized. We deliver all our lectures to ourselves per the bit. But I personally did not read on this special because I only hear from him. So okay, I say if I have the time, let me now go through. Of course, it was daybreak. And behold, when I went to the hall, it was cause and relation of facial nerve that we saw. And because he has said it, he has done so much on it, and that's how I wrote it. And I remember I scored 7/10 for that place. And it's not that I read it. So this is where the group discussion comes in, like a division of labor. Yes. Of course, you can't allow yourself to be burnt out. Yes, medical school is full of stress, no doubt about that. Again, you cannot do this without resting because your health is important. So many times, my colleagues has collapsed on what round, either from stress, burnt out, or hypoglycemia. Because that time when you're on call, your call starts like a resident. You don't leave your duty post when you're on call until 12 midnight as a medical student. 12 midnight. And then where we are taking call, it's not even where your hostel is. We track a lot of distance at night. It's not now that people are even when they have cars. No, you track. And when it is 12 midnight, your consultant will come and still check on you to be sure that the students are available. And that when we ask you, like when we are doing O&G posting, how many head have you catch today? And you show him your logbook. 12 midnight is there. So this is why you have to you cannot involve yourself in other extracurricular. So you can imagine somebody who is married. There are people, very few, one or two people that got married. In fact, when we were in Sokoto then, one person was in Kano. Yeah, she was married. She was married, yes. And the other guy was in Sokoto. So it's not easy. It's not really easy. So the little time you now have, which is your weekend, that is, if people are not on weekend call, so where will you? Your house chores is already there, and and it's not now that it's very fashionable that people now have house set. No, house was not already there. No, no. So it's really not easy, even as a single person. Nice. Then, of course, feeding is an issue. Because during our time, the federal government is not feeding anybody again. That is where you see that we say, so you hear some people say, I'm doing 001. Oh no, I'm doing 101. Oh no, I'm doing, like that. So that is just, I think organizations, you have to learn how to organize yourselves generally. But group discussion among your peers is very, very important. And of course, make sure that you come, if it is one round, you have to be there. If it is tutorial, you have to be there. If it is clinic, you have to be there. Anything, because on that day, what may say you don't know. Some of these things you are hearing passively, or they ask you to do, you think you have done, you may not have the time to read it again. And that may be what you'll be asked to do on that day. And because you have done it, Allah has a way of what? Of rewarding hard work.
Yes.
It will just come to your brain and you do it, and it will look as if you've been doing it all the time. So I think industriousness in the clinical practice is very important. Then when it comes to pediatric, I'll be able to elaborate further.
Yes, sir.
Yeah.
Okay, so we would still reach the section of pediatrics, but we are going gradually.
Oh.
Thank you very much for clarifying this. Yeah, it hasn't been really easy looking at your time. Do our time, some things have actually changed. So now we'll talk about a little bit about excelling in clinical rotations, because this is a clinical education, medicine itself. So the first thing is, how can somebody get the most out of his ward rounds? Talking about the case presentations too, and also the hands-on learning. Because the reason why we are asking this is, if you look at the typical ward round here, specifically this current pediatric set, almost 20 people in one group, and you also have residents. And at the same time, if the ward rounds is going on, different stuff are being discharged, which somebody might not really know if it's for the residents or for the students. So how can somebody make the most out of these ward rounds? Because Prof. Bellon said something that if we could take effective notes from our ward round, we could use it as a kind of book to be able to pass our clinical exams.
Okay. I think I'll cone it down to pediatrics. You see, let me tell you, clinical posting generally, like we said, medicine is adult learning. Clinical posting generally, you learn a lot passively, not actively, especially when it comes to clinical posting. Passively, not actively. That is the truth. Don't forget I mentioned that there are something you'll be told during word round.
Yes.
You may never have cause to read it. You may never even see it. And it is what you'll be asked on that day. And reflexly, it comes to you because you've been going to word round for one way or the other. It has been repeated here and there. But very importantly is you applying yourselves. And how do you apply yourself? Is that if they said you are supposed to present case, go to the ward most of the time. The ward should be your second home. The ward should be your second home. Don't restrict yourself. Track any patient you can see. Don't restrict that you must present to consultant. No, you are just deceiving yourself. Consultant are most of the time not available. Present to anybody, be resident, be house officers. Present to him, to the person. But you can only do this because what do I mean? The more you clerk, the more you'll be challenged to go and read the case you have clerked.
Yes.
And sometimes, even when you clerk a particular case, you go and read. Oh, you say, so question I have not asked for. For instance, you talk of bronchopneumonia. Oh, there are some risk factors that I have read. Now, I didn't even know. I'm thinking that teacher has bronchopneumonia. And even when I went to the case note, it's bronchopneumonia. Oh, and I've read that social. You go back again to ask such for the risk factors. And by that, it has sticked. when we are presenting, the consultant or the resident, we now make correction. Okay, you didn't ask this, you have asked this. You didn't ask, you have asked that. I can assure you that when you go back to crack another bronchopneumonia, you'll be far, far better than what you are, if you can remind yourself. That is just it.
Yes, sir.
Okay? I remember during my, a lot of people have phobia for pediatrics. But pediatrics sounds a bit interesting. But before you can be the level of interest in pediatrics, you have actually applied yourself completely. Then that's when you started seeing the good out of pediatrics. And what is that? Serial clerkings of patients. When I was very young, I always said this. I was a medical student. I think, if at your level, I think it's almost, no doubt about that, over 20-something years ago. I have a registrar. He's a professor now. Anytime, Suleiman, call me Suleiman. Suleiman, I have admitted also patient. Go and clerk. It's to the extent that in a day, this woman has made me to be clerking patient. 5 patients in a day. Up till 11 in the night, she would admit, say, okay, go and clerk this patient and be ready to present her. She was a registrar. At that time, where will you even, the consultants are very few and sparse. The same thing with registrars. Of course, as I was clerking, it reached a time in pediatrics, I don't even need to remind myself of the next level. Oh, biodata, presenting complaint, he's for presenting complaint. It become part and parcel of me. And because I've clerked so many, so there are, similar things. So I became very faster in clerking. And when I'm presenting, over time, I could present without a single paper on my hand. And mind you, that is part of the exam. Even in the final exam, you can be presenting. The examiner will just collect the paper from you. So don't think that it's wicked. No, it's part of the exam.
I face similar just in the exam.
Good. Yes, it's part of it. And then there will be, in fact, it is exam examiner that will collect the paper from you.
Yes.
But because you have applied yourselves. Now, this case, what happened? I was thinking that woman hated me because she don't allow me to rest in pediatrics. Each patient she admitted, it must be me to go and clerk. And she was so good to me, I didn't know she was so good. She must be there for me to present until our exam, fourth professional exam, MBBS. The case that was my lung case, what? Pertussis, whooping cough. And she has made me to clerk pertussis over 8 pertussis. And now it's pertussis. So everything I ask, then they are just put one. In fact, I finished my clerking, and I was one. Our external examiner was this man, Professor retired now, Omokodium. And she was one from Ibadan to come and she's one I presented. When I presented, and this woman who is a registrar was a chaperone, my chaperone, coincidentally. When I was flowing, she was just smiling. She was just smiling. It is then I discovered that, Ashe, no, I was thinking this woman hates me. No, she likes me seriously. And that is when in fact, we discussed that case up to complications. Of course, how many of us that start for the pediatrics? I think about 20, is it 25? I can't remember. But I can show that 17 failed. Okay. But I'm among those that participated. So the point I'm making is that pediatric is not difficult. No. But if you make it difficult by thinking, I can't come to the ward, I cannot do this, then it becomes very difficult for you. But if you come to the ward, it will reach a time that if you don't come to the ward to clerk, you are not even comfortable.
Yes.
It will reach that time. So apply yourself. Your team is on, whether your team is on call or not, you are in the hostel, you are not doing anything. Come to the ward and clerk, because there are some things. That's what I said. That time when I clerk, if you cannot take it, anybody I see, please have clerk. Okay, come and present. You will learn 1 or 2 things, and over time you become very robust. So this is the best, whether you are doing O&G posting, internal medicine posting, surgery posting. No, just go by the curriculum. You are supposed to be so there. Clerk your patient very well. Try and present to the consultant and to any other person that may be available at you.
Yes.
you stand to learn so many things at a time. This is just the answer. But if you are thinking you are going to be a theory doctor, you can be in your bedroom to go and read something, pneumonia, read everything, cram everything. I can assure you that yes, you can come. They will ask you clinical question by the bedside.
Yes.
And you may not be able to answer.
Okay.
Yes.
It's true, sir.
That's the truth. That's the truth. And you may not be able to answer because some of the clinical thing we are talking about is not in your routine textbook.
Sure.
So that's why the prof said that, yes, if you can actually make a good note of your word rounds, genuinely,
Yes, sir.
you just need a little thing to talk with. Yes.
Okay. Thank you very much for that, sir. Now, this is one of the very much important part that we are going to. You always emphasize on becoming a genuine medical student and genuine medical doctor. So, sir, can you clarify to us what does it truly mean to because we are becoming doctors, inshallah, after this December. So, and our juniors too are coming up. So, what does it truly mean to be a genuine medical student and a genuine medical doctor?
Okay, thank you. Yeah, I think that is even my popular language.
Yes, sir.
And some people call me genuine.
Yes, sir.
Yes, genuine simply means original. Genuine means original. And we know that original does not originate from anywhere.
Yes.
Huh?
Yes, sir.
When we say something is original, for instance, if you say this original certificate, you can only have a carbon copy. You can't have that same original again. So genuine means being original in your profession. And how do you become genuine? Is to by branding yourselves. How do you brand yourself? Is to what? To be very, very industrious. Go extra mile. For you to brand yourself, you must go extra mile to give yourself a feather that makes you a unique person in that particular field. I always tell you, I don't look for money. I don't. But money look for me. Why should I chase money? No. If you know what you are doing, people must definitely look for you. So to be a genuine medical student is that it's not far from what I've just said. Always, if you are to be in your classroom, be there. Make maximum out of it. If you are to be in the library, be there. Make maximum out of it. If you are to be in your ward round, if you know what is expected of you on ward round, you are supposed to have clerked and present the case to your consultant. Do it. From when you present, the consultant, okay, come and demonstrate this. No, you didn't do it well. He or she will correct you. What is the causes of this? Some question will be asked. You didn't know it, then you'll be corrected. But if you did not have clerk to present, you will have missed that opportunity. And mind you, knowledge, once acquired, cannot be taken away from you again. Good. And once you are displaying it speaks volume of you. Nobody will want to know what is your source of knowledge. No. So medicine is one of the practical things I discovered. Yes. Now, if you think you are very talented, you are very brilliant. One of my professors said that no. He said it is the person that is in the world that is the most brilliant. And I agree. Okay, you are so brilliant. Oh, you can talk about cause of convulsion within 30 seconds. Everything. You are supposed to be at your duty, but you are not your duty, and they brought convulsing child. So can those your stuff about the seizure there? No, the answer is no. No, sir. So, and it is only when you are there, you'll be able to practicalize the knowledge. That's what makes you genuine. Yes, sir. You get what I'm saying? And it is this, your practical exhibition on patient. How you're able to, up to today, if I'm clerking a patient, I don't know how to do shortcut. No. If I'm examining, I don't know how to do, because I have trained myself. I've been trained from head to toe. So if you are that type, that you are thorough, the chances of you making mistake in terms of clinical is very, very minimal. Look, doctors are trained to be able to stand on our feet. Laboratory is just there to support you. Yes. Internet is just there to support you. But the bulk of the something is you, the doctor. So if you have read very well and you have had a lot of exposure, experiences, no, you will not see somebody and children, they don't pretend. Once you're able to make a right diagnosis with a right treatment, that child will start smiling.
Yes.
The following day. So as a pediatrician, you have, in fact, even as a clinician generally, but I'll call it down to pediatrics because that's why I know.
Yes.
For you to be genuine, you must be truly genuine, not theoretical. No, you must both sound in the theory and what in the clinical practice. And where you're supposed to be there, you are there. Eh? If you are moving stops 10 kilometers away from your duty post, and they brought even your own child convulsing, you cannot abort it there. It is the doctor that is there that is more brilliant than you at that particular time for that particular case.
Yes.
So, if you want to be genuine, then sit up to really work very, very hard. That will now brand you as a person. And that is why people will be looking for you. That please come, please this sir, I need them. And when people are looking for you, so in the end, what is looking for you?
One.
Is the one that is looking for you.
Yes, sir. Yes, sir.
Yes. Thank you.
Thank you very much for that, sir. Now, this section is actually about the pediatrics and you yourself, sir. So I would like to know, you have so much inspiration in pediatrics. You do it with joy. So first of all, we would like to know what inspired you to choose pediatrics as a specialty, sir.
Okay, thank you very much. Let me tell you the truth. A lot of us, I think, if we samples medical opinion, majority will not like pediatrics.
Yes.
In the beginning, and I'm one of them also who does not like pediatrics. My initial field of thought was internal medicine because I feel they are the one that you can talk to and to get their lines. They can tell you where, what this and that. But pediatric can frustrate you in such a way that you, on one line, you can spend 2 hours, yet you still not get that line. But like I said, repeated exposure of all this procedure make you a better doctor. That is why when you are doing it over time, you discover that, actually, you are very, very perfect. Yes. Lines that people cannot set, you just come because you'll be setting it. Look, in pediatrics, there's time, especially for children that is a bit obese, there's a time when we set line blindly. Wow. And yes, and you'll be there. Because you have done it severally, those that you can trace the vein, okay, over time, okay, I know. Most of the time there is a vein here. Even though I cannot see it. No, let me just find blind, and you'll get it. So, what actually inspired me is when I was a medical officer practicing, a young medical officer in now Federal, then it was Federal Medical Center, Brain Kirby, now Federal Teaching Hospital, Brain Kirby. While doing that, I said, no, I'm going to write medicine, internal medicine, why, this and that. That's conflict until I am posted to pediatrics. So then I started practicing pediatrics. Like I said, from the medical student, from medical school, my registrar really paid my mind because the pediatric becomes so part of me. Because of the way she forced me to collect. Then when I now come again, not too long in my medical officer practice, they say I should go to pediatrics. Before I know it, I become the acting head of pediatrics. So that interest comes. Now, as God will have it, I just went to the primary in pediatrics once, both national, West Africa. And that time, you have to travel far to Lagos and to Ibadan.
Yes.
Because it's not now that there are branches to Ibadan. And I just got my exam first. So now, again, that now inspired me. Of course, there are a lot of NGOs collaboration that we are doing because I was privileged to be acting head of pediatric departments. I'm into those fields like all this UNICEF, WHO, all this malnutrition program. I remember that in this country, in the country, I was the first trained clinical instructor for severe acute malnutrition management in the country. I was part of the first set that went to train in Ibadan in Rovans Hotel. So as a very young medical officer, I've been involved in so many pediatric activities. Then because of that, I became the deputy head of clinical services. I have so many positions, administrative positions in my life, that people are even thinking that whether I will be able to come for residency training. Yeah. Of course I did, because I was determined. So when I now come, in fact, I remember when I was coming, some of those would say, sir, will you be able to, it involves sleeping it? Because I become like executive there. Sir, will you be able to take calls? Will you be able to sleep? I said, no. If that is what it takes to do it, why not? I can do it. And when I come, I was determined. And I pushed myself that, no, I can do it. And I must do it. And I will do it. And I did it. So I am and as a resident, if I see any case that I'm not familiar with, I'll go to my senior. They will guide me, give me book to go and read. I will make my notes, everything. And I'll make sure that I still come back to recrack that same patient. No, I will say that I have to, no, I'll come back to recrack that same patient. That's the truth. And when I went for one of the part 1 exam that I passed in pediatrics, they gave me a case of retinoblastoma. I remember. Yes. Me, I don't know how to write on the paper that I'm clerking. I don't know. What I wrote then was jotted down was the biodata. Then examination fine, then maybe the height, the weight, interpretation. That's all. So when the examiner come, there are 3. 1 female, 2 men. They are all professors. Yes. That's why I should present my case. And I started talking without paper. I screened the paper, sir. When I finished the summary, then one of the examiners said, please, where is the clerking? I said, yes. He said, but you didn't write anything. I said, yes, it's in the brain. They started looking at me. I said, how? I said, yes, I don't know how to write because it will waste my time. They collected the clerk, they said it's just the name, sex, whatever, on examination, all the figure that I may forget. And, okay, examination fine, and I wrote it. Because, of course, I'm the type that I love teaching medical students, naturally. That's why a lot of your seniors, that some of them are even already a consultant now, I taught them. So because I do it, it's already part, so demonstrate, I'll demonstrate. Ask questions. I remember in retinoblastoma, when we discussed it, they did not even ask me to classify. I give them classifications. Wow. And one of the examiners, I said, he said, Prof, what do we need to ask him again? We did not even, what you don't even ask him to do. He has given it to us. Yes. And of course, the maximum score you can score in long case is 52. And I was scored 51. That's the truth. Because it's a closed marking system. Yes. So what am I trying to tell you? You must have satisfaction in the job. And the only way you can have satisfaction is a clinical something. You must apply yourselves. You must be, if you have a patient, clerk thoroughly, examine thoroughly, clerk thoroughly, examine thoroughly. Don't assume anything in medicine. No, assumption is not allowed in medicine. No. Check the throat. Make sure you have checked the throat. Check the ear. Make sure you have checked the ear. For cases that supposed to have done that. Check everything. You may never tell. That is where the diagnosis may be. Yes. So, and once I do that, I have my results. Prescribe this. Before you do it, alhamdulillah, the child is moving up and down. So that satisfaction is there. The genuine satisfaction is there. And I am happy. Yes. So I have a lot of inspiration. I have no problem, honestly. I told you, even inside my dream, I speak pediatrics. So I have no problem. And anytime I'm teaching, I love teaching. I used to joke with the student that if assuming I'm teaching outside, even lizard will come and be listening to my lecture. Yes. Yes, thank you.
Thank you very much, sir. So, sir, finally, is there any advice you could give like students that are considering pediatrics as a career?
In fact,
like a brief advice?
If I'm to advise, in fact, pediatrics is very rewarding. It's spiritual. It's spiritually inclined. It's rewarding. That is the truth. And mind you, contentment, pediatrics will give you contentment of mind. Somebody can have millions, but he's still struggling, chasing. But if God can give you a blessed thousands, and you are more contented than someone who has millions, and that's what pediatrics does. These children of your seeing, no. That's why I always say pediatrics is a calling. can imagine they are so innocent that even if you give them acid to drink, they will drink it. We all have a children. Give your child acid, they will drink it. God, the confidence is there.
Yes.
So those things, if you are in a position to now better their life, to now treat them, to now make them smile, no, you are fulfilled now. Which one are you looking for again? No. And mind you, richness is in the hand of Almighty Allah. This is what people don't know. Richness is in the hand of Almighty. He gives to those whom he so wish to give. Those who that are rich today, what did they do? It's not that they are better than you, or they are clever than you, or they are. Yes, they apply themselves, but the richness is in the hand of God. So, and that's who am I today. I'm a happy person tomorrow. So my advice is that if you want to be happy and be contented, don't think twice to come to pediatrics, but you must be genuine.
Yes, sir.
Huh? I always said, for you to be a pediatrician, you have just called minimum of 10. Yes, 10 over 10. That is the minimum for you to be a pediatrician. What do I mean? You don't need to be reminded to be at your duty post. You don't need to be reminded to do what you're supposed to do. And empathy is always in you. That, oh, this could be my child. Once you have all these things, I mean, it's not true. The day you are genuinely tired, God will make sure that even if such case come in, He will bring someone that will come and assist you. That's the truth. There's no cutting of corners in pediatrics, no. Well, you can go to other areas, maybe 1% areas. I don't know. But for pediatrics, you must be genuine and committed.
Yes, sir.
So this is honestly, I always encourage people to come to pediatrics, especially, in fact, we are all parents now. The mothers, take it a challenge. Fathers, come. You are more useful to the society. You are contributing a lot to the society. Money is not everything. And as a pediatrician, if it is your destiny that you are going to be very rich. And most of the people's problem is trying to live a false life, trying to chase money forcefully. Then at the end of the day, you started creating a lot of morbidity to yourselves. People will look at you, you don't even have rest of mind. Yeah, you like a hunter. You're there. No. So honestly, that is just my single advice. People should pick interest in pediatrics. But I'm not saying everybody cannot do the same thing. No.
Yes.
But of course, give other areas a priority too. But once you know that you are genuinely committed, then please don't think twice. Come to pediatrics and meet us. Yes, and you will be happy together.
Thank you very much.
All right, thank you
for the session.
All right.
It's been a very interesting session. You've really given us a vast amount of advice. We really appreciate having you. Finally, if there is just like one sentence for the audience, specifically the medical students, that we could use to close these sessions up. And we hope to also have you in some maybe pediatric specific talks.
Okay. Like I said, when we talk about medical students at umbrella term, there are people who are single, there are people who are married, both male and female. Yes, it's true. There are mothers among them. In fact, sometimes we are doing well and you see somebody with fundus abdomen. He started limping. I said, oh, it's okay. It's understandable. Honestly, I really sympathize with women. In other words, the women are trying because it's not easy to reconcile so many things. A lot of hormonal issues, physical stress, and all that. But of course, it's doable. That's why I always say that it's not easy and it's not difficult.
Yes.
So you can reconcile it too. But my own is that for everything you want to do, have a job satisfaction. Be happy doing what you are doing. If you're not happy, leave that place. You have no business staying in that place. Be genuinely happy that you are doing it. And that's what will bring job satisfaction. Laziness is not in pediatrics. No. That I was telling medical students this afternoon. I said it is when you are now tired, that after you have done what round you are presented, that is when you start. That is when the learning of pediatrics starts. When you think you are tired, that is when the learning of pediatrics starts. And what do I mean by that? Go and pray, rest for 30 minutes. If you want to take a bottle of Coke, if it's not Ramadan, take it. Don't go back. Come back to the ward and start clacking a patient in this tomorrow. And when you clack that patient, look for any resident to present to. Look for any senior person to present to. And it is in that same time that you think you are clacking. That when you see some nurses doing a procedure, oh, I'm nebulizing. Oh, you see, this is how they used to do it. Oh, I'm doing gastric lavage. You watch all these things,
Yes.
then you go and read them, so that you have the scientific based knowledge. Or no, went to war and so what is it? I saw, you see how NGT were being part. You see, it is done in those odd hours, what we call unholy hours. That you see all those things are being done. You are tracking a patient. Oh, please come to the doctor. This child is convulsive. You quickly go and withdraw your anticonvulsant. You see the child calm. Oh, what is the cause? You jot it. I'm going to read about convulsion today. This child has convulsion and fever, febrile convulsion and fever. But if you think that when you finish, nobody, yeah, you have gone to the hospital. You started snoring. See, you're having a REM sleep. Then that's how pediatric will slip away from you.
Yes.
You know what I'm saying?
Yes.
So for everything, all you need to do is determination, dedications, and be there when you are needed at all times. That's all. So you shouldn't have any other life apart from your clinical work. When you graduate, you can choose, okay, now I'm a doctor. Okay, this weekend I'm not on call. I will go and visit person. Yes, that's why most doctors were socially a bit poor. But that is our life. That is our life, because you don't have any other home other than your home and hospital. That is the truth. The genuine clinicians has no any other. It's difficult for you to see a doctor say, "Oh, I'm going to visit in 24." No, it's not possible. Most of the time you're in the hospital. So my advice is that please, we should be determined. We should be happy doing what we are doing, and we should be genuinely dedicated to our job. You'll be happy with what you are doing, and we should always have empathy on what we are doing, in the sense that have a reflection. Oh, this child is coming today. Why? Why is that when I'm okay? It could be my child. If it's my child, what do I expect? Do that same thing, and you'll be happy. Thank you.
Thank you very much. All right. Thank you for your time.
Yes.